Welcome to The Beat, the podcast where we talk about building equity, accountability, and trust with law enforcement. Today, our topic is responding to mental health crisis in the community. And I am Dr. Lori Hall, and I'm joined today by two guests. If y'all want to introduce yourselves.
Sure. Good afternoon. My name is Megan McGee. I'm the Assistant Director of the Administrative Services Bureau at the St. Petersburg Police Department.
Hi, my name is Imani Prez. I'm one of Dr. Hall's students. I've
Awesome.
taken actually multiple of her classes.
Yeah, for sure. All right. So thank y'all for the introductions. Today we're talking about responding to mental health crisis in the community. And one of the main reasons for this podcast and having this conversation is to really provide a law enforcement perspective on what it's like for law enforcement to be met with and challenged with the mental health crisis that we're experiencing across our country. And as with anything else in the world that is difficult to deal with, we hand that responsibility over to law enforcement. And so law enforcement have had to learn quick. They've had to evolve and they've had to adapt. And so today I just want to talk a little bit about what are some of the ways that not necessarily St. Pete Police Department, but just police officers in general are responding to mental health crisis. What are we doing?
Right, absolutely. That's an excellent question. There is CIT, Crisis
Mhm.
Intervention Training, and CRIT, Crisis Response Intervention Training. It's a 40-hour training that is available to officers. As you can imagine, that's a bit challenging to pull many officers off the
Absolutely.
street, off of their day-to-day responsibilities, to lock them in and attend that training. So, a lot of law enforcement agencies are exploring different models that they're partnering with nonprofit organizations, behavioral specialists that they can co-respond and certainly see if they can divert certain types of calls for service that are nonviolent, non-criminal in nature that have a mental health component so that they can be responded by mental health professionals.
Yeah, so you introduced the idea of CIT. So CIT is rooted in the Memphis model,
Mhm.
right? So this kind of
Right.
originated in Memphis. I don't know, maybe back in the '80s or
Mm.
something like that, and it's focused on intervention training, teaching officers how to identify and respond to mental health, but also it has a lot of components of scenario based parts of the training. Um, One of the challenges that you mentioned for law enforcement agencies is the 40-hour requirement,
Mhm.
right? That's a lot for law enforcement because what you do is you pull these officers off the street, you put them in a classroom, but you have to still have officers on the
Correct.
street, right? And so, the amount of time and money that it takes to do that is difficult. But from the general public's perspective, they argue, well, 40 hours isn't enough.
We've definitely heard that, and I think again that, puts a lot of, impetus in the argument of trained mental health professionals that are
Mhm.
licensed and have devoted their career and many, many years of study towards mental health awareness, being able to de-escalate. It really, lends to an important partnerships that law enforcement agencies can have. The officers that we have trained at the St. Petersburg Police Department, they're excellent at what they do. We're so glad that we have that training available. We do scenario-based training for our officers. A lot of what I think we're going to see in the future is a lot of kind of VR and AI-based trainings. We're hearing more and more about that and the technology that maybe makes it a little bit easier to deliver those types of trainings on demand in a way that maybe
Mhm.
isn't as impactful on the time spent in the classroom. But again, you still do want to have that significant amount of training so you're ensured that that training is effective.
For sure. And there's also the growing movement towards like mobile response, crisis
Mhm.
response, where we're involving mental health counselors in responding to these calls for service, especially when there is a nonviolent situation. But a lot of times it's a co response where law
Mhm.
enforcement are involved. There's a lot of people in the community, in the public, not just St. Petersburg, but nationally, that are pushing towards removing that responsibility from law enforcement of responding to mental health calls for service, and placing it on outside agencies. Do you see any of that in St. Pete Police Department, or that trend or that movement towards that?
Sure. Well, if we were to go back to the late 80s, the original model, kind of the grandmother of all of the idea of a civil response, a civilian response to these types of mental health calls is the Cahoots model in Eugene, Oregon.
Right.
And there really hasn't been a lot of it since then. When we started to have that discussion again nationally was after the murder of George Floyd. That was when there was a
Mhm.
bit of a national reckoning of policing, and the community started asking about different ways to respond to mental health related calls, and not just mental health, substance abuse, youth related
Right.
calls, basically what you would kind of term as a lot of quality of life related issues that were
Mhm.
not criminal and not violent and shouldn't be
Yeah.
on law enforcement officers' plates.
Yeah.
Um, the co-response model can be very, very effective, but what we decided to do in St. Pete is we felt very strongly that if we implemented a multi-phased project to ultimately get to removing law enforcement from the response, we believe that would be the most effective. But it also relied on us being able to identify the right types of calls. So
Mhm.
that really comes straight from dispatch. That call,
Mhm.
that's the caller speaking with our dispatch, offering up, the details of what's going on. It's us relying on our data. Is there an alert associated with an individual? Things like that. And us being able to vet a call safely.
Right.
Safety has been a part of our program since day one as we implemented it. And it's certainly something that we've had no incidents of violence, we've had no incidents of injury, but it is
Mhm.
something we have baked into our program from day one because it is so important with a civilian response.
Right.
And I think that's what does keep some of the other agencies, it kind of holds them back from taking the step towards having a civilian only response.
Mhm.
Certainly, we've designed our program that if our we call them call navigators. If our navigators are responding and they need law enforcement to accompany them or to meet them on scene, absolutely, that
Yeah.
can very easily happen. We've built that into our program.
Yeah, and I think, and you mentioned another important aspect of how we respond to mental health calls for service is the accurate identification, right? So when these calls come in, it's up to this one individual to be able to communicate to dispatch that this is a mental health call. And sometimes those individuals don't even know that that is what's going on.
Right.
And it creates a lot of difficulty for assessing that situation. How do we even know who we send?
Right. Sometimes the person's calling about themselves. They could be calling about their neighbor. They could be calling about the loved one, or they're calling about somebody they see on the side of the road on their way to work.
Right.
So, as you can
Yeah.
imagine, the amount of information coming from the caller
Mhm.
really can vary.
Do you think that for law enforcement, they're getting better about being able to make those assessments?
They're definitely I mean, our emergency communications division is absolutely amazing. They're an accredited excellent organization that has been able, I think, to really be able to discern and pull that information out of the caller. We do have those systems available, like I said, if we need to pivot to a co-response, but it is definitely a situation where the caller provides the information that's available at that moment. If there is additional calls that come after the initial call, then we update that dispatch and the additional information is provided. We also have, with our relation, because we have a partnership with a nonprofit, Gulf Coast JFCS, so they are our partner in the call program. They deliver the services as the navigators and the clinical consult, the clinical support of the program. They also have the ability to refuse a call if they have any safety concerns.
Mm.
but we're about
Yeah.
98% of the calls that we send to them requesting that they follow up directly. These are live calls coming from dispatch. About
Mhm.
nine, we're I think the lowest were 95, the highest is around 98% they're able to respond to without law enforcement. So
Wow.
we've been able to vet appropriately, and we're looking at mental health related suicide, neighbor disputes, which you wouldn't think would naturally kind of fall into that, but sometimes it's
Yeah.
about the length of the grass, and then sometimes it is definitely a
More.
mental health
Yeah,
call.
for
Sometimes it's
sure.
a mediation, they need
Yeah,
something kind of
for sure.
mediated. And also we've really looked to expand for youth related calls that shouldn't be going to law
Mm.
enforcement to really reduce unnecessary contact with law enforcement for
Right,
youth
yeah.
if it's truancy or playing basketball at 10 o'clock at night and
Right,
somebody
yeah.
calls that into law enforcement. So
Yeah.
we've expanded the scope of the different types of calls for service that are appropriate for our civilian responders to respond to. It's been very effective around the hurricanes. We were able to utilize that for calls for assistance, check welfare, those types
Yeah.
of calls.
Mhm.
It's been an incredibly powerful for like partnership and really been a great benefit to our community and the most vulnerable within our community.
Can you talk a little bit about, like, what a response looks like? Like, you get a call, it's identified as a mental health call for service. What happens then?
Right. So you had mentioned, the caller provides the information, whoever it may be, if they're calling about themselves, it goes through the vetting process. No call gets sent to the call team unless it's been reviewed by a supervisor within our comm center, our dispatch. And then it goes over to the call team who also has a supervisor review. They've been in service, they've been providing services in our community since 21, February 21. So they look within their own records to see if this is a client that they've served before, and a two-person navigator team goes out. Nobody
Mhm.
goes out to these live calls by themselves, and they respond. The first thing they really do is try to listen. They have the ability to spend time on a call that a law enforcement officer would not.
Right,
They'd
yeah.
be, they have to respond, figure out what's going on, and potentially clear the call, move on to the next call. They are able to really spend some time understanding what's going on.
Mhm.
If it's a mental health call where there's a concern that the person may harm themselves, they certainly have a lot more tools in their tool belt, where a Baker Act is not their first step. And
Right,
that's why we
okay.
have seen a significant reduction in Baker Acts since we've implemented the call program. As you can imagine, like I said, officers are a little bit limited. They can Baker Act, they can leave. There's only so many things that they can do, whereas the call navigators and the therapeutic element of it and the licensed mental health counselors can put a safety plan together. They can talk with family members. They have a couple different options of what they can do to ensure safety.
Do they have, like, a referral or triage process for
Yes.
after that?
They have continual follow-up. They never close a case unless the individual moves out of the area or something like that. On certain calls, let's say it's not as acute as a suicide threat. It's somebody who, maybe is depressed and has some concerns. Um, they might refuse services. Well, they'll keep trying. They'll
Yeah,
make those calls. They'll stop by because what we found is somebody might say no 10 times, but
right.
the 11th time they might say, you're right.
Yeah.
A lot of what they may do on those responses is if there's med management concerns, they try to have those linkages to ensure that people are stable. And there are abundant resources that they have under their own umbrella because we partnered with Gulf Coast, which is a large nonprofit in our area. They have a lot of services, so it's a lot of kind of seamless connection from.
Yeah.
Good example is they have a lot of services for the elderly under their umbrella, and as we implemented and rolled
Do y'all
out.
find that y'all have adequate support in terms of when you need a service, not just within Gulf Coast, but anywhere in our region? that you're able to find those services?
I mean, everything's underfunded and there's never beds available.
Right.
I
Yeah.
mean, that's,
So that's a challenge that law
yeah.
enforcement are facing. And that's another thing that I don't think that community members, the public really kind of understand is while, law enforcement are tasked with handling this
Mhm.
issue, the support and the resources are not always there. Some
Correct.
communities are doing better than others,
Right.
but when we're talking about a national mental health crisis, right? We're talking about higher rates of depression, anxiety, PTSD than we've seen, right?
Mhm.
And it's getting to where it's impacting younger and younger individuals
Yes.
that there's only so many resources. There's only
Mhm.
so much infrastructure that we've got. And this is uh, a system that's rebounding from
Mhm.
deinstitutionalization,
Yes,
right?
we're still
So when
seeing
we,
that.
back in the 70s, when our federal government defunded mental health asylums,
Mhm.
defunded the mental health care system, we took steps backwards.
Right.
As a community, as a society, we went backwards and we didn't focus on it. And then the crisis hit
Right.
and we started scrambling,
Right.
And so then we said, oh, well, law enforcement, you deal
You
with
just
it.
deal with it. They wear many
And
hats.
yeah, for
Many, many
sure.
hats.
And so while they're tasked with dealing with this problem that's in a rebound and we're trying to learn, they're trying to learn, and then they're dealing with scrutiny, right?
Mhm.
All of the public's perception of do this,
Right.
but not like that. Well, not like that.
Right.
But don't do it like that. Well, why don't you do this? Right?
Right.
And at the same time, we're not giving them enough money to be able to adequately resource this, right? And so is St. Pete kind of struggling with some of that as well?
During and post COVID, we saw some incredible spikes
Yeah.
in mental health needs and a real spikes in suicide threats. Luckily, we with the fact that we had the program in place right around that time, I think really was able to kind of quell some of what could have been a larger spike in actual suicides because we had those additional resources that weren't there 2-3 years ago because we had those resources available through the program. But everything, continued to be strained as far as resources. And we, for quite some time during COVID, a lot of crisis beds were closed, were unavailable. So I think, even when I look at the data from the last couple of years, we'll have always that time period
Yeah.
that things it's hard to compare things to because
Right.
it's we're still seeing the effects. And I agree, you mentioned with how it's affected children and young people. I think we'll still continue to see the effects on youth mental health. So we have at St. Pete, we have definitely tried to expand some of our programming specific to youth as well, because that is an area we want to make sure that we are putting resources and attention to.
And that's an area that's even experiencing even greater strain.
Mhm.
When you talk about, psychiatrists that pediatric psychiatrists, there are not many.
Right.
And they have a huge client base that needs services. And so I know, John Hopkins, their
Mhm.
pediatric psychiatry, their wait list is like
Right.
years long.
Right.
Right. And so then that creates an increase in response and need from law enforcement to handle these situations. But I wanted to ask you, are there ever times where, law enforcement are responding to these calls and their hands are kind of tied in being able to provide whatever resources needed?
Oh, absolutely. I mean, I can say since we've implemented this partnership with a mental health provider, with a human services provider, we have now given them an option. If they're responding and it's something that maybe was not appropriate for the call team to respond to, so a law enforcement officer did respond, they can respond accordingly, but they can still go back and do a referral and have the
Mm.
call team follow up and say, hey, we did this. Maybe the person didn't meet criteria for a Baker Act, but I'm still concerned because of XYZ. And then that officer, he or she is guaranteed that a navigator team will follow back up, link for resources and other things. They're for our officers, they may still have a piece of paper with all of their resources that
Yeah.
that they keep in their car, some pamphlets and things like that that they keep in the cruiser, but they now have a connection that is within the department that they can utilize and say, hey, we have this call program. Do you want me to have them reach out to you? And that's been really effective for them because they truly see it as an investment in what they have available. The
Mhm.
tools in their tool belt aren't just tasers. It's also these are some resources that you can have when you're responding. So
Right.
the officer buy-in when we implemented the program was excellent.
Mm.
It ramped up a lot quicker than I thought it would. I didn't know if it would be like, hey, what are they, what are they doing here? What are they?
Right.
It was very very positive, and
Mhm.
um, Chief Holloway always kind of jokes that, that if he goes and pops into a read off and talks to officers like what's good, what they'll say like don't take that program away because for them they feel like it is something that helps them in an area where they had the limited
Right.
resources. Our officers don't have the time to keep up on how many beds are at St. Anthony's, how many they just don't, or what nonprofit organization opened up that has resources for this need and this need. So it's
Right.
really
Yeah.
helped them to have that partnership.
And that is so important, the officer buy-in, because I know that it's a make or break. If you can't get officer buy-in, then how do you even
Right.
effectively utilize this program,
Right.
you know? And I think that that is also a way of sending the message to the community that this is important, that
Hmm.
we should focus on this. I want to ask, um, because it's something that shows up in the news and the media and all of that with regard to law enforcement responses to mental health calls for services. Um, there are some instances where use of force occurs, right? And these situations don't go in a positive way.
Hmm.
Um, I want to talk a little bit about the 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 difficulties that law enforcement face when they respond to these calls for service. And like we said before, like they might not know, right? And their job is to, ensure the safety of not just that officer, but for everyone. And when they have an individual who is in a mental health crisis, and maybe maybe they are trained, maybe they're not trained on identifying this.
Hmm.
Um, but this is a high stress situation, and their goal is really to, ensure safety and mitigate this. But can you talk a little bit about the challenges that maybe law enforcement are facing when they go into these calls and maybe something goes this way?
Well, as you said, I mean, there are certainly behaviors that come from different mental health disorders. We've seen it even with changing behaviors for dementia and other things like that. So, when somebody is called into a situation with often limited information and there's not a lot of background to concerning behaviors, I mean, that is uh, that is definitely a challenge. I don't know if I can speak specifically to the officer viewpoint as I'm not sworn,
Right.
um, but that is definitely one of the considerations as an agency
Mhm.
where we see value in having an alternative response.
Are y'all doing anything to ensure that all officers are receiving some type of training to be able to identify those mental health
Mhm.
indicators so that they are prepared?
Yes, officers receive training on mental health. And we also, on the flip side, we also do a scenario based training specifically for our call team that our training division does to also help them be prepared in their on-scene response that's focused on safety. So it has elements of some of the things that law enforcement officers would be trained on, like head on a swivel when you're entering a home, things like that to ensure their safety.
One thing you were mentioning stuff after COVID. I also feel like a big thing that affected things is money.
Mm,
Because my mom, she runs her own business. Primarily, it is she does a lot of work online, but she has constantly said that ever since the pandemic, her like the money that she gets in has not been the same since before the pandemic.
yeah,
She was struggling during the pandemic, and she still struggles, even though it's been years
right.
since afterwards. It's like people are still like, because she deals with like do hosting events, so she'll like have businesses pay for a table, whatever. But more and more businesses are still kind of like
Yeah, the
about it.
bounce back is definitely
Recovering.
still not here. And
Yeah,
I agree, like financial strain is definitely a big contributor to
and
mental
again,
health.
she does her own thing. It's mainly just her. It's mainly her. So
Mhm.
she has to do all this. So she has to reach out to people, and she can reach out to tons of people. But if they say no,
Right.
it's like, so I also feel like that also like puts more stress onto people
Oh, yes.
of
Yeah.
like, okay, you're dealing with this mental health stuff because, and also again, the pandemic itself.
Right.
All of a sudden, this thing happened. We never
Yeah.
thought this would happen. We had to stay at home for at first it was a couple weeks, then it just kept getting longer, longer, longer. People kept getting sick. People kept dying. Some people lost loved ones.
Right.
And
And all of
stuff.
those impacted
And all,
individuals'
and
mental
then
health.
also
Of course.
young kids who ended up growing through the pandemic. I was
Right.
lucky enough that I was already like registered as a homeschooler, so I already did online schooling, so that didn't even change much. But like, of course, we
Mm.
still couldn't go out. We just
Yeah.
kind of like stayed at
Mhm.
home. My mom,
Remove
she loves to go
isolation.
out.
Right. A
Yeah.
lot of
It was just
social
like it
disconnection
was
for
just
kids.
my
Yeah.
mom, my little sister, and me. So my little sister's like
Yeah.
around 5 years younger than me. So yeah, we just had to like stay at home. Um, sure, we were still able to do our schoolwork, which was still nice
Yeah.
because it wasn't that much of a change in terms of that. But like, my mom, she likes to go out, so it's like
Mhm.
she
Yeah, I think you're
once that
mentioning a
happened, she
lot of
like
the
wanted to like make
challenges,
up
yeah, that everybody
for
was dealing
time
with.
to like go ahead and go out because it's been so long, and then of course shortages, toilet paper, food,
Yeah.
so on and
Sure.
so
And
forth.
there was a lot of economic drivers that, several months after we a lot of the calls for service that would come in on our non-emergency line would be relating to economic needs.
Yeah.
So that became another thing that had we not had this partnership with the call team, those calls would have been coming in and, what's law enforcement can't respond to a family that is about to be evicted. That's
Yeah.
that's a challenging situation. We would have to
Mhm.
try to identify other types of resources, but now we have a partner who is able to go and respond and try to seek additional options and housing plans.
Right.
So
Yeah.
that made a huge difference as well, because absolutely
Yeah, and then
they're
of course you have the people who were on site, on call,
yeah.
helping people, which is a whole completely different thing where they're trying, and people in like the medical community, they were scrambling, trying to find
Yeah.
something to like, they're scrambling for a vaccine, and then of course
Mhm.
people were complaining about masks and stuff like that. We had to
Mhm.
really try to severely convince people to wear
Yeah.
masks, while like say in other countries, mainly in Asia, it's kind of commonplace where if you're
Yeah.
sick and you go out, you just wear a mask
Yeah.
like that's more of a commonplace thing of like, okay, you go out but you wear a mask. But since that wasn't really a thing here in the US,
Yeah. It
people
was
super
scary.
like
It was definitely
went
scary
against
for
it.
people.
Some people, and then people for a long time, even when the pandemic technically ended and quarantine was lifted, people still kept wearing masks. I know my family did, and now
Mhm.
everyone's kind of going back to normal, whereas like
Yeah.
that stuff. But yeah, even financial, some stuff just isn't back to normal. Some people
Yeah.
still aren't at the place that they would have been. They aren't earning the money that they
Right.
they
Yeah.
were beforehand, and that just puts
And we
strain on
also had social
finances.
media
Mm.
that kind of really propelled around this same kind of time.
Mhm.
And that contributed to it as well, but also the the disconnection that social media creates in the connection that you have. Those connections are not
Mhm.
um, really genuine connections.
Mhm.
And so, people, while we are an ever connected society, we're becoming more and more disconnected from each other, which creates these feelings of isolation.
Right.
And it is contributing to this rise in mental health issues for especially younger generations. But I think that one population you kind of mentioned that we don't necessarily even think about when we talk about mental health is the elderly,
Mm-hmm.
right? When we talk about dementia and we talk about Alzheimer's, these are diagnoses that kind of, have similar indicators of mental health crisis. And, when these individuals are in crisis, law enforcement have to know how to respond because we say this is
Right.
your job.
Right. And, we have trainings on all, Alzheimer's and some of those behaviors. And I know some other agencies have done like different registries for different things like that as well. But yeah, that's certainly a big concern because there's behaviors where they may wonder, leave their house. We've seen hoarding behaviors. We've seen just a lot of family members that live out of the area, so there's really nobody local to check in on them. Or if you do have a family member that's checking in, and they're calling in for a check welfare on their
Yeah.
loved one, but they're many
Yeah.
thousands of miles away. So it does require that different type of response to be able to identify what's going on, and not everybody can necessarily view and understand some of the early signs of
Sure.
that decline or cognitive
Yeah.
decline.
And it didn't help that the pandemic also severely stunted, especially younger children's
Mhm.
developmental growth. Because again, you're supposed to be able to socialize, you're supposed to be able to go out and like
Right.
learn that sort of stuff. But now all of a sudden, these kids who were in public school, again, I have been homeschooled most of my life because my mom, she travels for business, so I did online public school programs through being a homeschooler. Me and my little sister
Right.
both do. So I like was used to it because I would also help my mother with her business. I would help her day of doing stuff. So it was like that was like the only
You got
viable
that
thing.
interaction.
Yeah, I
Yeah.
was like the only viable thing because sometimes she would go out of state
Yeah.
and she can't just like leave us by ourselves like a
Right. Yeah.
teenager and her five
Yeah.
5 year younger
Yeah.
little sister. She couldn't do that. So what did she do? She
Right.
just switched us over in other like circumstances. And so I was used to that, but other people aren't used to that. It's a
Yeah.
much more unique life,
And
a
it's
childhood
hard.
that I
It's
had.
hard.
And again, for like isolate, I wasn't necessarily isolated, but I didn't exactly have many friends growing up because again, by being homeschooled, I stayed mostly out, and I would still interact with family or whatever, but I didn't exactly have too many like
Right.
friends
Yeah.
or whatever, or like I could still interact with kids, but I was younger. I found it a little hard to interact with people my age, but older, younger. That could also have been because I am autistic, so there's also that as well
Yeah.
for differences. But again, it's like we were both kind of used to it, so it's like okay, it still like affected us, but like not as bad. But then you have kids who like go to public school, constantly interact with other kids, and then all of a sudden, plop, you just have to
Yeah.
stay at home with your family. That's just how
Right.
it is. And then also kids who might not have had the chance to really experience that, they are still growing up in this intense isolation. And I'm sure many people, well, I don't personally use social media because I never really, even though like obviously I grew up in the age of social media, I never got into it because I never saw a point to it personally. Other people, they're more
Yeah.
into it. And how do you get interaction? Social media. And with how social media spreads information like wildfire, both true and false,
Mhm.
and half truths, half falsehoods, it's like not only are you isolated, you're so aware of like all the bad stuff happening.
Right. Yeah.
So it's like you have this, okay, you're by yourself, there's a pandemic, people are dying, this. And then also, even after the pandemic, we also know that there's other bad stuff happening, maybe not in our country right now,
Yeah.
but in other parts of the world.
Just
so you're
the constant
constantly like
negative
hearing this is
communication.
why I also don't look at the
It
news.
really weighs on people. There's even research that says that when people watch the news, their heart rate, their blood pressure goes up. To, constantly be met with social media that is, sensationalizing all of these negative things that are happening, the one or two isolated incidences. They don't focus on the actual calls for service, like the vast amount that they actually respond to. Whenever you contextualize it in, we responded to over 1 million calls for service during this time period, and you put one on there, there was a negative outcome, right?
Mhm.
Let's talk about what does that percentage look like? What is
Right.
the
Yeah,
breakdown, right?
sure. Yeah.
And so it creates a lot of challenge for law enforcement because they're constantly having to counter these narratives that it's just they're out of context, they're misinformation, and the general public is just not really aware of what law enforcement are doing to really equip themselves with the knowledge and the training that they need to be able to go out and
Mhm.
respond to mental health crises in the community because they are there to serve, they are there to protect, and they're doing the very best that they can with the resources that they have,
Right.
right?
Also, something I wanted to comment on when you were talking about the public like scrutiny of like the outcomes. This was something that was talked about in a previous class I had with Dr. Mark Pezzo in his judgment decision making class. One of the biases we were talking about in terms of like judgment and stuff was hindsight bias. Many people like
Mm.
obviously talk about hindsight bias, but he went into more depth and he actually used the example of a police altercation where it's like where he's like, okay, before you like judge a police officer for okay, maybe in he in like an altercation or whatever, the person was innocent, but the police officer still shot the person.
Mhm.
Obviously, people they now know the context, so they're like, "You shouldn't have done that," so on and so forth, or whatever.
Mm.
But he said, like, in the officer, he didn't have that.
Oh,
We
that's
have the
important. Yeah.
hindsight bias of like, okay, we know the information. That's why it's that people say hindsight is 2020 is because now that you
Right.
know the information, you look
Mhm.
back and you're like, oh, obviously. But in the past, the
Mm.
you or the police officer or whoever they don't have the information. They are literally just
Yeah.
going off what they know in the moment. And for police officers, situations can turn fatal and deadly like very,
Yeah.
very quickly.
Yeah.
So even though obviously we're just like, but it's like
Yeah.
at the same time, the officer and like people say like, oh, whenever say maybe a person of color goes to
Yeah.
reach for something and a police officer immediately, like obviously there is still a very big possibility that it's also racially charged. I'm not saying like no officer immediately thinks the worst or whatever.
Right.
Um,
I think you bring up a good point though about the contextualization because that's really the issue that we're contending with, not just about these calls for service that are mental health related that kind of
Mhm.
maybe don't go in the direction that we would hope, right? But just in general, those calls that don't go in the direction that we would hope. In most cases, individuals are judging with the full knowledge
Right.
of what's going on and they forget that that law enforcement officer, one, doesn't know everything that you know.
Right.
He came into that, he was interacting within 5 seconds, and he was having to do what he could
Right.
to ensure
Split
safety
second.
of everyone in a moment and ask questions later.
yeah.
You don't want law enforcement to get onto a scene and say, "Okay, let me sit here and try to figure out all of the
The whole point of law
context."
enforcement is that they,
Like,
you
yeah,
know,
like
Right.
wait for you to actually shoot someone
yeah,
before I do something. We don't want that
Right.
world, right?
yeah. And of
And
course,
and we
you know,
forget,
they have a bad
yeah,
reputation because, and I'm not saying like
of
all
social
police
media,
are,
of the media, right? They're not
Mhm.
and like,
presenting
you
the
know,
right.
genuinely worser people who have, you know, used power for bad, you know, their authority for bad, or who genuinely maybe shot at someone because it was just solely racially charged or whatever. And like statistically, while technically, okay, I don't know specific statistics, but I think I was talking to someone, I can't remember who. But they did say like statistically it does happen that minorities do tend to have like, you know, the more like violent crimes, but then we also have to think of the context for that of like the communities, poverty, like, you know, the socioeconomic status of the places that they
Well,
are
we have
often
to
in
think
and
about those
stuff.
statistics because, like, there's a lot of people that will push this agenda of like, oh, well, there's a high rate of black on black crime. There's a high rate of, like, black individuals that are incarcerated. It must mean this, right?
Mm.
But we have to also focus on the larger scale of that, right? And not get fixated on the explicit, right? Because a lot
Mhm.
of people in the public want to say that law enforcement are doing this with this intention, this bad intention, right?
Mhm.
And that law enforcement are these things. When in reality, law enforcement are humans. They're acting in ways of protection with, the same intentions that I think anybody else would. But at the end of the day, they're humans and they act in implicit ways, in similar ways that most individuals act in implicit ways, right?
Mhm.
You have to like contextualize, right? And not demonize populations that may have more contact with law enforcement. There are reasons for that, right? There are reasons that they have more contact. Um, and we're going to talk about that on a later episode.
Yeah, because I can't remember who it was I was
Yeah.
even talking about, but they did bring that up of like, yeah, maybe black people might have more higher rates of violent crimes or like whatever. But like if you think about the context of like why that
Yeah.
is, oftentimes they're in unfortunately a bit worse off neighborhoods when it comes to
Mhm.
socioeconomic status. And then sometimes in those like worse off neighborhoods, that's where the crime happens. And if so it just so happens that this minority is in that area, it's like what would you expect to happen if it was primarily white people who were like in those neighborhoods? I'm sure that same thing would still happen, where it would still be a lot of violence and crime. It just depends. But since
Yeah.
some people see, oh, there's these people in these areas, it's like, oh, so then it must be because of whatever. And yeah,
Mhm.
again, like people have implicit biases, unconscious
Mhm.
biases that they don't even realize that they have
Yeah.
and stuff. But
And
yeah.
law enforcement are doing a lot of work in that area on implicit bias too. Um, so going back to mental health calls for service, we talked about the training, right?
Mhm.
We talked about the programs that are being utilized, even talked about the call program that
Mhm.
you have at St. Pete Police Department, which is kind of unique to St. Pete.
Very
Yeah.
unique. We
Um,
I don't know if I can say this for sure, but I believe we are the only model in the state that
yeah.
tries to our goal is to completely divert these calls from law
Right.
enforcement.
Yeah. So we talked about what you're doing. We talked a little bit about CIT, co-response,
Mhm.
and then we talked a lot about public perception and just kind of recognizing the factors that kind of contribute to the ways that law enforcement respond, and then the ways that the public view law enforcement and
Mhm.
their responses. Even kind of talked a little bit about the history of how we got where we're at.
Right.
And so I think that it's important that we recognize from this conversation that law enforcement are doing a lot of work in the area of responding to mental health calls for services, specifically in training themselves
Mhm.
in awareness of mental health. And also St. Pete, I mean, you're really working hard at developing a system where you can divert these individuals away from the justice system
Mhm.
and into behavioral health care, right?
Mhm.
To get them
Absolutely.
attached to the services that they need so that we can reduce the amount of calls for services, reduce the amount of
Right.
interactions so that we can really kind of mitigate any of the issues that could arise, right?
Correct.
From some of these situations because these are highly volatile. One, you've got law enforcement calls for service in general, period. That is just a very volatile situation. You don't know what you're responding to. When you add a mental health
Mhm.
situation to that, it only heightens the
Right.
risk and the concern. And so I think for most people, we have to understand that law enforcement are doing their diligence. And at the end of the day, they're humans that are trying to respond to these tasks that the community is saying, can you please deal with?
Right.
So thank y'all for coming
Thank
out
you.
and talking to me today about responding to mental health calls for services. This is The Beat, and we are talking about building equity, accountability, and trust with law enforcement. We'll see you next time.